Hello,
Hello, doctor.
my name is Dr. Bhakta. How can I help you today?
My wife is having pain when she uses the restroom.
Okay. I'd like to speak with her if that's possible.
No, she doesn't speak with men.
Okay. Why is that?
Well, we are Muslim, and part of our culture is that married women do not talk to men who are not their relatives.
Okay. I understand that, but in order for me to do this, I would need to have to speak with her, and I wouldn't be able to further go my practice if I can't speak to her.
Well, she has signed the paper.
Okay, I see that here, but I'm still really not all that comfortable with that.
This is our culture, and we have different beliefs than you.
Maybe so, but like I said, if I cannot speak to her, I cannot do a further physical examination.
Well, you can ask me, and I'll tell you. She's never been sick, not in the hospital, nor surgery. She takes no medicine, and she has no allergies.
Okay. I have no proof of that, and even if that is true, I would still need to do a physical examination.
Can you leave her clothes on under the gown, and you can just move them out of the way, around as you see fit?
I really don't feel comfortable practicing medicine that way, so if you guys are not okay with that, then I think you'll have to find a different provider.
Do you not take care of children?
I do, but this is different.
I don't think it's different. You let the parents talk for them. I think it's because we're Muslim.
Hello?
Hello, doctor.
Alright, my name is Dr. Bhakta. And you must be... Who do we have here? This is full on? Yes? Did I pronounce that correctly?
Yes, hello, doctor.
Okay. What can I help you with today, Miss Full on?
My wife is having pain when she uses the restroom.
Okay. Oh, I'm sorry to hear that. But if you don't mind, I'd like to speak to your wife.
No, she does not speak with other men, other than me, her husband.
Okay, why is that?
Well, we are Muslim, and part of our culture and practice is that women cannot speak to men who are not relatives.
Ah, okay. Well, I'm sorry. I did not know that. But thank you for letting me know, and I'm sorry if I offended you in any other way.
It's okay.
I just want to let you know that because she is my patient, I have to be able to communicate with her. To further assist you and to make sure that I do my best to do my job to alleviate her any pain that she's having.
No. I already told you that is not possible. She has signed the paper that says I can speak on her behalf.
Yeah, I saw that. The nurse gave that to me. And honestly, I've never had this situation, and I don't feel comfortable with that. So I would still have to, find a way to be able to interact with her.
Why can't you just help my wife? I do not wish to argue with you anymore. I just want my wife to feel better.
Right, I'm sorry you feel that way. I'm not trying to cause any problems here. I am trying to do my job here, sir. I'm trying to help her. But it does become difficult to do my job when I cannot speak to her and figure out how she is feeling.
Look, doctor, we were told that you were one of the best in California, and I have not seen that yet. All you have done is just argue with me, and nothing else but that.
Well, I am very good at what I do. I've practiced this for a very long time. And honestly, sir, if you want the best care that I can provide for you and your wife, I would have to be able to communicate with her and provide a physical examination, right? That's very standard in this kind of procedure, right? So I would have to do that.
Absolutely not. No. She will not speak to you, and I will not let you touch her. That is very disrespectful.
Sir, how do you expect me to help your wife then? If I can't speak to her, if I can't do a physical examination, I won't be able to help her in any way. If you do not allow me to do those things, nothing we do here is going to help.
We don't wish to go to a different doctor because you are a very good one. And is there just any way you can help us to alleviate these circumstances?
I think I will be able to, I just have to make a phone call. Also, I would like to tell you in advance that there is no female doctor in this office, right? So what that would mean is I would assume that you don't want me to touch your wife, which is understandable. What about what if I were to bring in a nurse? Would you be okay with me, doing the examination with the nurse in the room?
Yeah, I'm sure that will work.
Okay. Now, when the nurse arrives, I will have to ask you to leave. That's just for patient-doctor confidentiality. I understand that you were speaking for her in the beginning of this process, and I don't think that it would be good for me to do my job that way, right? I understand that you're her husband, but when it's going to be me, the nurse, and her, I would like to, get her reaction and see how she really is feeling. I understand that you may know how she is, but I would like to see that from her.
Oh, she is my wife, and I would like to stay.
Right, I do understand that, but it does go against protocol. I do understand that you did sign that paper, but that was for you to speak on her behalf. But this is a little bit different now because we're following a different protocol that the nurse is going to be in here. So to make sure that there's nothing wrong that's going to happen. So your wife is in good hands, don't worry, and I will treat her with respect no matter, what the case is.
Okay. I guess that'll be fine.
Yeah. Let's see. So then I'm just gonna go outside and make the phone call. Does that sound okay?
Yeah.
Get the nurse in here and we can get this moving.
Okay. Thank you, doctor.
Yep.
Everything will be okay now. You can just talk to the nurse.
Okay, I'm glad you guys got that worked out.
Hi. Yes, this is Dr. Okta from 2715. Yes, I'm with the patient, Mrs. Fullhon. No, there's no problem. I would just need a nurse, a female nurse to come in. The patient is Muslim. Yes, exactly. Oh, great. Okay, you had to do that before. Yeah, the husband just wasn't comfortable with me being in the room alone with her. Right. So if you were to come in, speak to her, it is against the religion. I found out. Right, for me to talk to her. Yep. Perfect. Okay. Send her in at about, as soon as possible, maybe 30 seconds. Yeah, they've been in here a long time, and I don't want them to wait any longer. Okay. Thank you. Bye-bye. Thank you. Hi, Mrs. Fulham. This is going to be Nurse Ritz. She's going to be in here. She's going to sit in, and she's going to help me do this examination, right? Obviously, because your religious preferences. She's just going to help us get through this process, okay? All right. So I'm going to tell Nurse Ritz here to ask you some questions that I would ask you, but so that there's no direct contact between me and you. So she'll just be asking me the questions.
Are you comfortable with this?
I'm comfortable.
Okay.
Can you ask her how old she is?
How old are you?
I'm 30 years old.
She's 30.
And how long have you been having this pain?
How long have you been having the pain?
For about 2 weeks now.
2 weeks. And where exactly does it hurt?
Where exactly does it hurt?
My stomach.
Hurts your stomach.
Can she point to it?
Can you point?
Hurts right there. My lower stomach.
Okay. And what's the pain level?
What's the pain on a scale of 1 to 10?
About a 7.
7.
The whole day?
The whole day?
No, only when I have to use the bathroom.
Okay.
Throughout the day, it's about a 5.
There are 5 of them? Okay.
Do you mind asking her to change into a robe so that way I can further examine her?
Okay, so I'm gonna have to ask you to change into your robes, and you can be further examined. You okay with this? Okay. to it?